The Veraseal 3 non-vented mask by SleepNet is designed to provide optimal respiratory support for acute care patients in a hospital setting. Ensure you have the Veraseal 3 mask, headgear, and any necessary ventilation equipment. This mask is available in 3 elbow configurations: vented, non-vented, and non-vented with an anti-asphyxia valve. Wash your hands thoroughly and ensure the mask and components are clean and ready for use. Use a size guide available on our website or upon request to verify the correct mask size. When using the size guide, ensure the patient's mouth is slightly open. Line the top of the guide to the bridge of the nose and select the smallest size that does not restrict the nose or mouth. The appropriate size may be smaller than expected due to the design of the mask. The Veraseal 3 mask comes fully assembled and does not require additional assembly prior to use. Unhook one or both straps from the mask and place it on your patient's face. Seat the bottom cushion of the mask at the crease of the chin. Tip the mask up to contact their nose and reattach the straps. The mask may sit lower on the nose than expected, depending on your patient's facial features. The headgear should lay flat across the back of the head. Ensure the headgear is centered by aligning the top and the bottom straps. Then pull the straps back, adjust the strap tension, and affix the tabs. Turn the forehead adjustment dial to adjust tension until the patient is comfortable. If necessary, readjust the straps for a comfortable fit. Check for any pressure points or discomfort, then adjust as needed. To ensure a proper fit, avoid over-tightening the mask. This will help to prevent skin irritation and sores. The ergonomically designed air gel provides a shelf that folds in when touching the patient's nasal bridge. This reduces pressure on the nasal bridge and prevents over-tightening of the mask, which can lead to skin ulcers. Once adjustments have been made, connect the mask to the ventilator tubing and follow the equipment manufacturer's instructions for use.